myself for an opening statement. Over the past several weeks, the Health Subcommittee has led the way, bringing forward solutions to address some of the biggest challenges facing patients in our healthcare system. Today, we're continuing that effort by advancing critical legislation that will help patients access life-saving cures, enable seniors to continue receiving care from the comfort of their homes, strengthen the Medicaid program for vulnerable patients, and support our workforce so that every American can get the care they need. Now we have FDA-approved therapies that in many instances are the only treatments available for rare disease patients and their families. Part of the reason for the rapid development of these therapies is because of the congressionally established Pediatric Rare Disease Priority Review Voucher Program in 2012. Over 50 vouchers have been awarded as a result of this program, 39 for pediatric rare diseases, and over half of which have been awarded over the past 5 years. That's why I'm glad we're considering legislation which would continue life-saving access to therapies for kids living with rare diseases who currently lack any access to any treatments. I would like to thank Representative Bill Rodgers for his leadership on this legislation and encourage my colleagues to support advancing the bill to the full committee today. The acceleration of telehealth has also transformed our healthcare system, especially following the COVID-19 pandemic. Over 30 million seniors in Medicare utilized telehealth services throughout the first months of the pandemic, giving beneficiaries the chance to have routine healthcare visits from the comfort of their homes. Congress extended these flexibilities beyond the public health emergency, where they're set to expire at the end of the year. I would like to thank Representative Carter for his steadfast leadership on H.R. 7623, the Telehealth Modernization Act of 2024. This legislation serves as important guideposts of work we're doing today. This policy extends to the current telehealth flexibilities in our committee's jurisdiction for an additional 2 years and includes other reforms. While we have seen a number of positive developments in health over the past decade, not everything has been positive. We have seen an explosion in the rate of improper payments in the Medicaid program, reaching $50 billion in improper payments in 2022 alone. The Energy and Commerce Committee has done extensive work over the past several years to address these challenges, most recently considered a number of legislative solutions to stabilize the program. Among these ideas, we will be considering 4 bills that take steps to addressing key program integrity issues facing the Medicaid program, such as increasing the frequency that state Medicaid programs check to make sure they are not paying for deceased beneficiaries, and requiring regular updates of address information for beneficiaries so we don't pay for care for people who live out of state. I would like to thank Representatives Bill Rodgers, D'Esposito, Garcia, and Miller Meeks for leading these bills and encourage my colleagues to support this legislation. Last, but certainly not least, we will be considering legislation to support our workforce and improve access to care for Americans across the country. This includes the Accelerating Kids Access to Care Act, which will cut red tape for pediatricians, and my bill, H.R. 468, the Building America's Healthcare Workforce Act, which will help build more robust workforce pipeline for our nation's nursing homes. Both bills come at a critical moment of our country. Our healthcare system is facing stark workforce shortages that existed before the pandemic, but only have grown more severe in recent years. Since 2020, over 500 nursing homes have closed across the United States, and another 150,000 nurses are needed to reach pre-pandemic staffing levels. In closing, I would like to thank my colleagues for bringing forth the solutions we're advancing today. Patients, providers, and taxpayers will greatly benefit from the important bipartisan work we're doing today. I yield back and recognize the gentlelady from California, the ranking member, for 5 minutes.